In this PowerPoint, we'll be looking at self-care activities of daily living. So what will this training cover? During this presentation, we will get an overview of what activities of daily living are, and then we'll take a closer look at some of the self-care activities of daily living. This will include dressing, feeding, toileting, and sleep. It will outline the developmental stages, common difficulties with these areas, and useful tips and approaches for educational staff to support children to develop independence with these activities.
So what are activities of daily living, also known as your ADLs? So your ADLs are all the essential basic self-care tasks that people need to do every day to keep themselves safe, healthy, clean and feeling good. So this could be from getting up in the morning, showering, eating, etc. When referring to children, ADLs are typically supported by adults in their earlier stages. However, it is expected that children develop independence in these as they mature. ADL skills are important for children to develop as they support organisational skills. This includes the ability to plan and sequence tasks. They refine motor skills, so for example, things like opening lunchboxes, fastening buttons, tying shoelaces. And they also help with independence out of the home, for example, dressing for PE, sleep over at friends or families, and going on school trips.
So what are the building blocks for development of independent skills with activities of daily living? Children need to have hand and finger strength, hand control, be able to process sensory information, be able to manipulate objects, have both expressive and receptive language skills, must be able to plan and sequence, and also be compliant and motivated.
So some top tips for activities of daily living would include the use of a visual schedule, so a wall planner. This would be a great way to remember what tasks need to be done that day. Visual prompts, so pictures can be useful as a reminder to do some of the things that are often forgotten, such as packing a school bag. Reward charts for independent completion of tasks or an attempt at it in the early stages. Breaking down skills into smaller steps and supporting the child through each step so that in time they can do more for themselves. Keep a routine. Doing the same task at the same time each day will help children plan their day and not forget to do things that are important. Be consistent with the words and signs used to assist the child and keep instructions short and simple, and allow enough time. Ensure that there is enough time available for the child to participate in self-care activities without feeling rushed.
In this first section, we'll be looking at dressing. Looking at the developmental stages for dressing, from the age of about 12 to 18 months, children can start to get involved with taking items of clothes off by themselves. For example, they might be able to take their own socks off. And by the age of about 2 years old, children tend to start to help with putting clothes on. So they might be able to put their head through the hole of the t-shirt, or might be able to pull their pants or trousers up. As they get older, children will be able to manage simple items of clothing that can be pulled on or off and up or down. They will learn to manage simple fastenings such as big buttons, Velcro and easy zips. Problem-solving skills also develop in terms of working out which way round clothing items go and what order they need to get dressed in. As a child gets older and their fine motor skills develop further, they will learn to complete the more complex fastenings, such as bows, laces and ties. Dressing is a complicated multi-step activity. Many children have difficulties planning, organising and manipulating clothing. In addition to this, a child with sensitivities to touch and movement and decreased body awareness can find dressing a stressful experience. Frustration, loss of confidence and reduced motivation are possible consequences of difficult dressing experiences. Thinking about sensory differences, A child who's sensitive to touch can be irritated and distracted by the feel of their clothing. Imagine having a strip of sandpaper on the back of your neck and just how scratchy that would feel. This may be what it's like for a child who finds labels uncomfortable. Similarly, if a child has reduced body awareness, they may struggle doing dressing activities when they cannot see what they're doing. For example, when they have their jumper over their head or when they're trying to manage their top button. In these examples, a child would struggle to move their arms, hands and fingers into the required positions. If a child struggles with balance, then they may not be able to put their trousers, socks and shoes on. They may wobble and be unable to stand on one leg. For children who struggle with motor planning, sequencing of dressing activities could be difficult. They may struggle to plan how to start the task or how to complete the dressing sequence in the right order. Many dressing activities involve bilateral integration and coordination. For example, buttoning, zipping, and tying laces all require two hands to work together. These tasks also involve dexterous movements of the hands and fingers, requiring strength and stability while pinching, pushing, and pulling. If a child does not have these skills, then dressing tasks such as managing fastenings can be fiddly and frustrating. A child needs to be able to pay attention to what they're doing. If they have difficulties with paying attention, then they may become distracted by other things going on around them, and they may not notice if they've missed a step in the dressing sequence, or put an item of clothing on in the wrong way round, for example. A child also needs to be motivated. For example, tying laces is a skill which requires practice and perseverance. If a child's not bothered about being able to dress themselves, this may impact on their levels of independence, and they may be happy or content with parents and teachers dressing them. Some strategies to improve body awareness for dressing include the following. Playing games that draw attention to different body parts, for example, Simon Says, or copying someone else's posture, position and actions. Other games include balancing beanbags on different body parts and working out what positions to get into to make multiple body parts connect. To help the child build awareness of their body parameters, try getting children to draw around each other on large pieces of paper or on the yard using chalk. Other strategies include painting with body parts, such as fingers, hands and feet. Some strategies to decrease tactile sensitivities include deep pressure and proprioception. These activities through massage and firm squeezing and heavy work or body weight activities provide traction, compression and contractions to the muscles and joints. As a result, the nervous system will be calmer before dressing activities and the child will have reduced exaggerated responses to sensory input. It's also important to prepare a child for seasonal changes if they do have sensory difficulties. Take time to discuss it, prepare for it, and use social stories to explain the change. For example, having to wear jumpers or coats or having to wear shorts and t-shirts. Some other general dressing strategies to be aware of include the following. Encourage a child to sit down when putting socks and shoes on if they have difficulty balancing on one leg. Talc can also make dressing tasks easier, especially after swimming, and can be applied to the legs and feet or sprinkled inside socks and tights. Encouraging a child to dress themselves in the mirror is helpful because the child can use the visual feedback to monitor and make adjustments to their actions. They can also use a mirror to evaluate how well they have done and check whether their clothes are the right way round and buttons are even, for example. You can coach the child to self-evaluate by asking them to tell you what went well and identify anything that isn't quite right about their attempt. Obstacle courses are useful ways to improve body awareness, as the child has to work out how to navigate and manoeuvre their body between obstacles. It also teaches dressing vocabulary at the same time, for example, under, over, through and between. A simple strategy to use for children who put shoes on the wrong feet involves cutting a sticker in half and placing each half in each shoe, and when paired, this reconnects the picture on the sticker. Some approaches to support a child with sequencing or attentional difficulties includes laying out the items of clothing in the correct sequence and using step-by-step visuals. Backward chaining is a good strategy to use when teaching a child a new skill, especially if they're not motivated to participate or if they get frustrated when they cannot do it. Backward chaining enables a child to be successful in the task by breaking down the task into smaller steps and enabling the child to complete the task. On the slide, you can see the steps involved in taking off a t-shirt. The first step involves taking the t-shirt off for the child, talking them through the actions. The next time, you take the t-shirt off for the child, but ask them to do the last bit and remove their arms to finish off the task. The next time, you would get the child to remove the t-shirt from their head and their arms. You would keep working back, asking the child to do a bit more of the task for themselves if they continue to be successful. The child learns to do more of the task each time until they can do it independently from start to finish. In another example, if a child finds it hard to do zips, then connect the zip for them, but get them to pull up the zip. Some strategies to improve fine motor skills for dressing include the following. Play with dressing and undressing dolls and teddies gets children used to practicing fast things in a fun way. Dressing up costumes in old smocks and aprons can be also used in the early years curriculum. Games such as musical hoops can be a motivating way to get children to practice dressing and undressing. This game involves placing different costumes in hoops along a line, and when music stops, the children have to put a costume on that is in their hoop. Ripping up paper and card will build the strength in the small muscles of the hand required for grip. You can also get children to cut card with scissors, which will also build these muscles. Paper weaving, construction games and sewing games can teach a child essential skills for learning to do laces. Posting games such as putting coins in a piggy bank or playing Connect 4 build skills required for buttoning. Tying knots in rope and bows in ribbon can be easier ways to learn these skills compared to practicing on a lace. Threading activities and games which involve opening clothes pegs or tweezers will build pincer grip strength and dexterity required for manipulating fastenings such as buttons, zips and laces. Motor planning is the capacity to plan the necessary steps to achieve purposeful movements. You need to think about what the task involves, so see it in your mind's eye, to be able to organise the stages and carry out the actions in the correct sequence. Some strategies to help with motor planning include explaining the activity well and demonstrating. Break down the activity into parts and get the child to practice those first. Get the child to imagine successfully completing the task. Encourage them to stop and think first and avoid rushing. Repetition is helpful to ingrain the steps. Hands-on help might be necessary at first to actually give the child the feel of the required movement or position. This involves placing your hand over the child's hand and getting them to do the movement with you. Give feedback about what went well with a task and what they could change. This may include changing the speed, force of movement, timing and direction. Encourage self-monitoring. So ask the child to tell you why something went well or didn't go so well. Use visual cues to prompt the child, for example, visual picture cards. Reduce visual and auditory distractions to aid focus. And of course, allow plenty of time to practice tasks. Some ideas to specifically support with teaching buttoning skills includes starting to teach the task with large flat buttons before moving to smaller rounded buttons. Encourage the child to practice with the garment on the table in front of them to master the technique before moving on to buttoning clothing on the body. Materials such as felt are easier to work with rather than stiffer fabrics such as denim. Bigger slits can be cut into fabric when practicing to make it easier to push and pull the button through the hole. Games can be created which involve practicing buttoning and unbuttoning. You can sew buttons onto t-shirts and gloves and get children to button or unbutton small shapes of fabric. You can create a caterpillar from padded squares of fabric connected by a thick piece of elastic with a large button at each end. Repeating verbal prompts such as pinch, post, pull will help a child to remember the steps involved in the task. The top button can be practiced using a mirror so that the child can see what they're doing. Practicing doing buttons with their eyes closed will also help develop the ability to feel what they're doing without getting the visual feedback which is required to do the top button. Some specific strategies to support with teaching shoelaces includes the following. The texture of the shoelace makes a difference, so avoid thin and slippery laces. And teach the technique with the shoe on the child's lap, then with their foot on the stool in front of them before moving onto the floor, as this will promote hand functioning through positioning when first learning the skill. Tie 2 different coloured laces together and then replace the shoe so that one lace is one colour and the other lace is another colour. This can help a child when you are giving verbal instructions such as take the red lace in your left hand and the green lace in your right hand. The bunny ears method is easier for most children to learn if they can already tie a knot, as it just involves repetition of the same movement to tie the bow. When children have a lot of difficulty with fastings, you can consider compensatory measures that can make the tasks easier. These can be useful for children approaching comprehensive school who've been working on fastening skills for a while with limited progress. Ultimately, these dressing aids can help the child to get dressed independently. Velcro can be sewn behind buttons on shirts, so that the child does not need to be able to button and unbutton to put on or remove the shirt. Many high street brands do easy dressing ranges which do sell discrete Velcro options for shirts. Zips can be made easier to manipulate when hand strength and dexterity is reduced. This is done by adding a loop, ribbon or keyring to the end of a zip to make it less fiddly to hold and pull. Elasticated laces and ties can be purchased, which mean that the child can get dressed more quickly and independently. Long-handled shoe horns can be purchased for a child who struggles to get their heels into their shoes independently. And button hooks can be helpful to make it easier to pull the button through the hole.
This next section is going to be talking about feeding. So healthy eating is important for everyone, especially children, to ensure that they receive all the nutrients they need to grow and develop. Research shows that children who achieve a healthy weight tend to be fitter, healthier, better able to learn and more self-confident. This table provides an estimated guidance of what would be expected at each age group with regards to feeding. Developmental milestones can be helpful markers of typical child development. However, the age at which infants achieve many motor skills is dependent on how often they're promoted by the parent and performed by the child. Typically, we would be expecting a 1-year-old to be able to hold food and bring it to their mouth. At the age of 2, we would be expecting a child to be able to feed themselves with a spoon. This is usually around 15 months. At the age of 3, we'd be expecting the child to be able to self-feed without assistance. So this is referring to spoon feeding and finger feeding. And at the age of 4, a child will start using a fork, and this would start improving with practice. At the age of 5, the child will begin to use a knife to spread with the dominant hand while supporting the plate with the non-dominant hand. At the age of 6, they'll be able to use a fork and a spoon accurately, and they will start using a knife just to cut foods. And from 6 onwards then, we'd be expecting them to be able to cut, for example, meat with a knife with increasing accuracy and ability. As they develop, the coordination will increase with knife and fork use in a coordinated manner. Some common difficulties around feeding for children include sitting for meal times. So this might be challenging due to poor attention or being easily distracted. Sensory differences. So some children may show sensitivities towards smells or avoidance to specific textures. They may also become easily overwhelmed in a busy environment, such as a school hall. Motor skills. Children need to have good sitting balance and good posture to be able to sit at the table in a safe position for eating. They also need to present with good use of both hands in a coordinated way for skills such as cutlery. They may also present with difficulties around chewing or swallowing. If you do come across any child that has difficulty chewing and swallowing, please ensure that you seek advice from speech and language therapy or the child's GP. So some useful tips for feeding. The first one I wanted to start with was good positioning. So good position is vital for safe eating and encouraging self-feeding skills. It helps in the development of oral motor control and swallowing control, and it improves sucking through better strength and organisation of movements. The ideal sitting posture for eating requires the hips, knees and feet to be at 90 degrees with weight evenly distributed. It is important that their feet are flat on the floor or a surface underneath them, with their bottom right back in the chair. If the child's feet do not reach the floor, you could always use a block or a step to ensure that they have got that stable base. Children who have low muscle tone and reduced muscle strength can find it difficult to hold an aligned upright position. You can improve this by using supportive seating, and this is where we would come in as OTs, so please seek advice from your local OT. So my second useful tip for feeding, this would be consideration of the environment. So it would be helpful to reduce auditory and visual distractions when possible, particularly if the child is easily distracted or sensitive to these stimulus. Some children find busy environments, such as the dining halls, overwhelming, and they may either try to avoid this environment or leave early, not eating all of their meal, just to escape. Consider offering an alternative environment if this is the case, or selecting quieter times for that child to eat. It is important when possible to promote self-feeding skills to support independence. Ideas to support this could include food play. So food play outside of dinner halls can be a motivational way to introduce new foods, increase tolerance to new textures, and develop the fine motor skills required for feeding. This could include activities such as threading with cooked pasta, making marshmallow towers, and messy play with food colouring. Ensure the child has the opportunity to become familiar with new foods without the pressure of eating them, and allow opportunities to smell and taste if they are comfortable to do so. Patience. So allow the time and remain calm. Introduce new foods slowly and consistently to gain familiarity. Hand-over-hand support. If the child has difficulty with the motor component of feeding, they could be supported hand over hand to provide the physical guidance. Reward charts. These may be a motivational support behind self-feeding, and the use of adaptive equipment, which I will talk more about on the next slide. For children who have difficulty with self-feeding, there are a variety of adapted equipment available to assist independence, especially if he or she has a physical difficulty. So there's lots of cutlery on the market. Children with low tone or a loose grip can feed more successfully with cutlery, which has built up handles or potential straps or finger indents such as caring cutlery to assist with the overall grip. Bowls. Scooping food onto the spoon can be made easier with the introduction of a scoop dish, which is a small dish with a raised edge, as you can see in the picture. Scooped dishes often have suction pads underneath to secure them to the table, and if not, a non-slip mat such as Dyson could be used. Cups. There are a variety of cups also available which can help your child to drink independently. Cups with lids can reduce spillages, and cups with built-up or angled handles can help your child grip more easily. Remember, children with low muscle tone and reduced muscle strength can become tired during feeding. This can be helped by taking breaks. So, for example, the child and carer take in turns to spoon feeding and pacing the activity to suit the child. This information offers tips and advice for teachers where the child is having difficulty using cutlery at mealtimes. Things to consider. So check that the plate is in front of the child and is not likely to slip around. A placemat or Dysum can help with this. Have the right tools for the job. A serrated knife is easier for cutting meat and other tough textures, while a non-serrated knife is easier for spreading butter on bread. And also consider the equipment discussed in the last slide. Ensure the cutlery is the correct size for the child. Child-size cutlery or cutlery with wider handles tend to be easier to use and hold. So when we look at actually doing the actions of using cutlery, try the following. Look at how the child is holding the knife and fork. Show them how to point their index fingers down the shaft of the knife and the fork. Encourage your child to hold their knife in their dominant hand so they have more strength and power when using it. Practice using a knife and fork during a fun activity to avoid frustration. This could be done with something like Play-Doh or cookie dough outside of meal times. Try guiding the child's movements hand over hand. This allows the child to feel the necessary movements for cutting. This is a skill which requires regular practice. Your child may require some reminding about how to carry out the activity, and it can take a few months of regular practice to develop a good habit. So games and activities to help improve feeding skills could include fine motor activities, whether this is encouraging pincer grip activities by using small peg games, hand strength activities by use of Play-Doh or tweezer games, the use of two hands together, which is what known as your bilateral integration. So that could be through games such as threading. You could also have some fun with some messy play, so scooping and pouring water or sand into a sandbox or water box. Play-Doh is also a good one for encouraging cutlery skills. So scooping, stabbing, cutting and pinching pieces. Lots of children practice using a knife and fork together using Play-Doh because it's not within a meal time, so they're not as hungry and they're able to keep their motivation to stay on task. Imitation play can be useful, so pretending to feed a baby or a teddy, having imaginary tea parties, picnics or meals. And some games for oral motor skills, so that means improving the awareness and the motor skills around the mouth. Could include things like blowing up balloons, blow painting, party blowers, blowing bubbles, or the use of straws, so sort of spirally straws and skinnier straws, so to encourage sucking. They're all good for the oral motor skills.
In this section, we will be looking at toileting, providing some useful strategies for children who are struggling in this area. Let's start by looking at the developmental stages. Over the next couple of slides, you can see the typical developmental stages children will go through in regards to toileting. This tells us what to expect at different ages. However, there's no set age up to which potty training or toilet training should begin. The right time depends on the child's physiological development, which involves their bladder and bowel control, their motor skills, their cognitive and verbal development, and emotional and social awareness. Some of the common difficulties we see with toileting include the following. A child may not have yet developed awareness of bladder and bowel movements. They may not be able to communicate when they need to go to the toilet. They may have difficulties with planning and sequencing, so it might be hard for them to work out the order of activities required for toileting. It might be hard to get on and off of the toilet, or if the child struggles to sit and balance on the toilet, they may not feel comfortable enough to open their bowels. A child may struggle with being able to adjust the fastenings like buttons and zips and gripping clothing to pull up and pull down. They might find it challenging to use two hands together to unwind, grip and pull toilet paper. It might be hard for them to twist around and reach their bottom, and they might find it difficult to use the right amount of force when wiping, or they may not be able to wipe accurately. This may be because a child has reduced body awareness, so they may not be able to feel where they've wiped to know whether they're fully clean. A child might have touch sensitivities, so wiping might be quite uncomfortable. A child may also be sensitive to strong smells in the bathroom, and loud sounds such as flushes, taps and hand dryers could also be distressing for a child who's sensitive to sounds. There are a number of signs that a child might show which indicates that they are ready for toilet training. We may notice that they are aware of needing to go, demonstrated by behaviours such as squatting, grunting, going red in the face and hiding. They may not have bowel movements throughout the night, and they may be able to stay dry in their nappies for long periods of time. They may tend to urinate for a larger quantity at one time, rather than constant amounts in small quantities. Bowel movements may also become regular. It's useful to be aware of these signs, as you can work with parents jointly to help develop their toileting skills. Here are some tips to increase toileting awareness and support a child to be ready for toilet training. Consistency is important when it comes to toilet training, so link in with home regarding a plan. It would be helpful to keep a log of bladder and bowel movements to identify trends over a week, for example. You can log times of the day when the child has had something to eat and drink, and whether there has been a bladder or bowel movement. By noticing trends, you can prompt the child to try sitting on the toilet when you know that they normally need to go. Another strategy is to encourage a child to place their hands on their lower stomach whilst they're sitting on the toilet to help them increase awareness of their muscles contracting. Blowing activities while sat on the toilet help to stimulate pushing. For example, you can get a child to blow some bubbles, blow party whistles and musical instruments. Motivation to use the toilet can be improved by using dedicated toys or books that a child can use when sat on the toilet. You can also read social stories about toileting to help a child understand why they need to go. A sticker chart can be helpful to increase motivation. For example, if the child has successfully been to the toilet 5 times, they can then receive rewards such as a favourite activity or a treat. To help encourage young boys to be able to aim accurately into the toilet bowl, you can use little targets which can be motivating. Things such as ping pong balls or Cheerios or food colouring tend to work well. Some general toileting tips include considering a step, which can be helpful to make transfers easier and provide extra stability when seated as the child's feet are supported. Mirrors can be used by the child in the cubicle to check whether they are clean when wiping. Wet wipes provide increased sensation to the wiping area because they're cold and wet, so they provide the child with more feedback about where they're wiping, which can help them to be more accurate. It's important to consider the sensory environment, so think about whether you can make the environment more tolerable to a child with sensory sensitivities. For example, you could use towels instead of hand dryers and consider neutral or mild smelling soaps and air fresheners. You can also talk through each step in the toileting sequence to reduce the child's anxiety and give them time to prepare for each step. Encourage opportunities for messy play to improve a child's tolerance of different textures on their hands. Playing with paint, food, Play-Doh, water, slime, sand and mud are all good examples. Think about how best to help a child indicate when they need to use the toilet, whether that be verbally or through using visual aids or Makaton. Model the steps involved in toileting through play with teddies and dolls and encourage a child to get involved in this play. Here are some specific activities to improve wiping skills. Hand strengthening activities such as squeezing and squashing Play-Doh and scrunching and ripping paper. These activities will build the small muscles in the hands which are required for fine motor skills. Practicing weight shifting movements on the chair, for example, swaying and moving to music. This activity will encourage the child to weight bear on one bottom cheek at a time, which is required when weight shifting to wipe. Practicing passing bean bags between the hands around the body, around one shoulder, between the legs forwards and backwards, and in figures of 8 around the legs. These activities improve body awareness, bilateral integration and coordination, as well as encouraging reaching and twisting. Guessing games can be helpful to improve body awareness. For example, a child would have to discriminate what item has been placed on their lower back by the feel of it without looking. This will improve their ability to tell whether they are clean when wiping. Games such as removing sticky notes, tape or clothes pegs from the back of the child's jumper or the tops of their trousers can be helpful, as these games encourage practicing of the upwards wiping motion behind their backs. If a child struggles to complete these activities behind their back, then you can start by presenting the activity in front of them so that they can see what they are doing and get the hang of the technique. You can also laminate targets and put some shaving foam in the centre, then ask the child to wipe it off to practice the upward wiping motion. You can practice the wiping technique in the classroom by simply sticking 2 balloons together and tying them to the back of the chair. Then encourage the children to wipe upwards between the 2 balloons.
Our final part of this presentation will be discussing sleep. So what exactly is sleep? Sleep is an active process essential for survival. Both the brain and body are active during sleep and are involved in vital processes and functions, ranging from resisting infection through to consolidating memories. So how important is sleep? In children, sleep is important for growth, with certain stages of sleep associated with the release of growth hormones. It promotes healthy brain function and emotional well-being. It can improve learning and problem-solving skills, decision-making and creativity. It is important for attention skills. It is important for the body's immune system and helps tissue to repair. And overall, it leaves us feeling better. The American Academy of Sleep Medicine suggested the following guidelines for typically developing children. So the amount of sleep recommended for a 4 to 12-month-old would be 12 to 16 hours. For a 1 to 2-year-old, it would be between 11 to 14 hours. And a 3 to 5-year-old would be 10 to 13 hours. All of these would include naps. 6 to 12-year-olds is recommended that we would have between 9 to 12 hours, and 13 to 18-year-olds would be recommended 8 to 10 hours. So how common are sleep problems? In the general population, fewer than 3 out of 10 children are estimated to experience sleep problems. This figure is even greater among children with an intellectual disability, whose sleep problems also tend to be more severe and persistent. So what is the impact of sleep deficiency? Sleep deficiency can cause problems with activities of daily living, including learning, focusing and mood. Children who don't get enough sleep may have trouble making decisions, solving problems, remembering things, controlling their emotions and behaviour, and coping with change. They may take longer to finish tasks and have a slower reaction time. They may also make more mistakes. Identifying sleep deficiency within school. The signs and symptoms of sleep deficiency may differ. However, some children might be overly active and have problems paying attention. They might also misbehave, which means that their school performance will then suffer. Sleep deficient children may feel angry, impulsive. They may have mood swings, feel sad or depressed, or lack motivation. So what could be disrupting sleep at home? The environment. So room temperature, comfort, bedding, noise, lighting, visual stimulation or distractions within the child's bedroom. The child might be hungry or thirsty going to bed, which then in turn keeps them awake. They may be experiencing some pain or discomfort. There may be medical reasons behind their sleep deficiency. There might be a nap imbalance, a lack of routine in place, fear of the dark, or separation anxiety from a parent. To support a good night's sleep and sleep hygiene, we would recommend a good bedtime routine in place, so planning quiet time, limiting screens, and introducing calming activities. Reward charts might be helpful for parents to use at home. Environmental changes to the bedroom. This might mean removing toys or any clutter, checking if the child's bed is comfortable enough, as well as listening out for any noises that might be disrupting them. Environmental cues. This could involve closing the curtains at the same time every night and opening them at the same time every morning, just to differentiate between night and day. Hand-eye coordination activities. So activities like threading or jigsaws can help promote sleep. Diet. So avoiding fizzy drinks or sugar during the night and introducing sleepy foods such as almonds or oatmeal. Reassurance. So providing that reassurance to the child that you will be there the next morning and that you will start a new day. And resources. So sometimes CCTV can help manage parents' anxieties or help monitor children if there are behavioural concerns. An alarm clock, such as the Grow clock, can also help differentiate between night and day, which can be helpful for some children.